Has anybody got any questions of Pat?
Yeah, I was just wondering, when you transitioned from 2 hearing aids, you said, to a cochlear implant, what would you say your biggest benefit of having a cochlear implant was?
Oh, speech. Definitely, I was hearing so much better. The 8 to 10 that they told me would be the difference, 8 to 10%. Absolutely wonderful. It was, I did have a major infection 10 years later in that ear. Don't ask me how that arrived, but that was replaced. When we came up here, that's when that happened, just the last 2 years. Mm.
And would you say your family and husband also would, benefit from the cochlear implant?
Oh, definitely. So the day I went to switch on the first time in 2013, the family were here. My husband was actually just behind me there, and the audiologist in front of me. And when the switch on, I answered my husband, who was behind me. Whatever he said, and they couldn't believe it, neither could I. It was instant like that. So I've done very well. So yes, the second one, very good. We've got over the infection that I had in the ear. Yes, that was nice.
Can you maybe reflect on the issues that your husband had when he went into hospital because he's got 2 hearing aids?
Okay. Yes, my husband was in hospital for 5 weeks at Norwest Private Hospital. The night before, he had chest pain. He pointed like this, and he is 87, and I've been sleeping with a hearing aid in here at night so I can hear anything from him. And so I got up and we got the nurse down from Anglia Care, and we decided, yes, he needs to go to hospital. So actually I drove him myself. I was pleased because the ambulance would have taken him too far away at another hospital. I wanted somewhere closer to home. So anyway, Norwest Private, we went there. They couldn't determine the issue. In the end, it was lung cancer, liver and lung cancer. So he was put in a room, and the oncologist is ongoing management, but he had a sign on the wall to say, his name, the doctor's name, etc., whatever he said, but nil by mouth or whatever. And there was a logo for an ear. And I had given them all the history of Ken with his hearing aid deafness. And when they did this, they did not do anything about the ear to tick it to say that he had the deafness with 2 hearing aids. So I went. That was disappointing. So of course I got all that happening. And then when he moved to another ward, because they needed this room, he moved 4 times, I believe. That's what it was. Again, the sign didn't go up. Now, this is a private hospital. They had nothing there to say like this. Nothing. But I put it on his board. And it was COVID, which was another issue, which was not easy in hospital. So staff had to put everything on. You see, I had a pot of what he needed, like the batteries and all of that. Showed them, one of the staff, senior staff, how to do all that. And I found that he didn't have the battery change, so I had to do that myself. at the first time there were no batteries there and I didn't have any in my pocket. I went down to the chemist to buy some batteries. They didn't sell them. The chemist in this hospital didn't sell any batteries. So I went home and bought plenty and that was disappointing in a private hospital. They didn't look after his hearing loss or his devices.
You were a registered nurse before, so when you were in the nursing training, did you receive any training about accessibility and how to take care of people with hearing loss?
If I was honest, I would say no. I would say very little. And it's still there, you know what I mean? It's still not happening. And people with glasses, blindness or difficulty, they can be seen with their glasses on. You can't see that I've got a cochlear and a hearing aid. That is still very disappointing. And, you know, in here, I have spoken to the government. I was part of a submission years ago about all of us bringing up these points, that we go into nursing homes and there's nothing there. All the nursing homes, if I walked into all the ones that I gave those hearing helpers for, I wouldn't find one. I wouldn't find this either. That was there. So I'd like to make a big noise about it.
Okay, I think that's a wonderful idea because I'm an ex-registered nurse myself with a different specialty, and I know that for the staff to be able to have resource material like that on hand, so that if they have a particular client admitted, then they can refer to it. And whether it's useful to have, I don't know, some dare I say, volunteer to keep raising the awareness at nursing homes. I'm not sure if that's an option.
Well, I'm more or less a volunteer now, you see, so I could go in and, with my history, I could go in and start some process, but it's very hard to know where to start. I mean,
You need people. You need more people to do that.
You do.
Stand out. Yeah.
You do. That's right. So we'll give it some thought how we can, you know, get in there and make a difference. I mean, you know, you would have to think that something like that is easy, isn't it? Because you can hand them all, just photocopy all this 100 times. And it is all there. So, would they use it? They'd have to, wouldn't they? What do you think, Brandon? We'll get onto it one day?
Yes, it's definitely on our list because there's clearly a problem, you know, where people are not being supported, and then I think a lot of it's to do is that the staff don't have an understanding of how that can support people.
Yes.
And also that a lot of accommodations for someone with hearing loss are pretty simple. They're not difficult to do. You know, for example, if you're talking to someone in an aged care facility, they're in the room, they've got the TV on and they can't hear a bit, maybe go across and turn the TV down.
Yes.
So they can hear what's going on. And just simple things so that the staff have got an understanding of how to support somebody. So that's definitely something that HMA can work on.
Yes.
I just had a thought. If you're travelling, you can get a lanyard which has got sunflowers on it. It's called a Sunflower Lanyard. So if you're going to fly somewhere or go on the train, people fall over themselves to help you. Now, if somebody's deaf, how do we know they're deaf? I mean, I've got things sticking on the side of my head, which is quite obvious, but looking around, I don't know, because your hair covers your devices and so on. So perhaps some way to make it obvious. Now, the problem is people who are deaf don't like people to know they're deaf in a lot of cases, which is why they cover their devices up. But perhaps something, a badge or something nice but obvious, like an ear thing, to make people aware that you're deaf. Now, I know about nursing homes, and it's a problem because people lie there in their bed, they take the hearing aid off, and it gets lost. So these are things that need to be thought about, I think.
That's good comment, definitely good comment. It's, I'll tell somebody, but they can't, the way my hair is or my devices are there. You're right, they can't be seen. But I will tell people, I need you to speak louder or look at my face.
Yeah, one thing you mentioned, the Sunflower Lanyard program. Parramatta City Council have just trained their staff with disability awareness, and so they've got 140 of their staff wearing sunflower lanyards, and they're rolling this out program in conjunction with Autism Australia to alert people to hidden disabilities. So Parramatta City Council are getting behind the Sunflower Lanyard program.
It's a question of staff training, really, isn't it? I think lots of people who work in nursing homes have got a Certificate 3 in aged care, which is only a year's course, I think. So there's a problem with training. But I know the lanyard works. I've been overseas a couple of times with it. It's great. Get taken through special gates and thought quick. Onto the plane first. Yeah. Good.
I was going to show.
That's it. Yeah.
You know about the lanyard, do you? And the sunflower being the symbol of a hidden disability. So
No, I haven't seen it.
if people, say for example, have dementia,
Yeah.
they would wear this. So they say if you're travelling, then hopefully people, when you're travelling, will recognise the sunflower as a symbol and give extra help and attention. And maybe something in the nursing home, they can wear a little sunflower badge or something like that. Yeah. My children insisted I have this overseas, so I could wear it. And I've got your little sign as well.
You can get them at railway stations.
Yep.
And also just send up an email to the Sunflower Project and they'll send you one free. So, I think everybody who has a hearing difficulty should have one.
Yeah, if it get kicked off around the 2012 Olympic Games in London, because they had the Paralympics coming up a few weeks after the main Olympics, and the UK government wanted the staff at the airport to understand there was a lot of people with hidden disabilities coming through and how to accommodate them. So they made a part of the program was to issue the sunflower lanyards and let the people know that the staff had an understanding that there were hidden disabilities and a degree of understanding on how to support them. So it just made the whole event more welcoming. So you're starting to see it rolled out here. Like Parramatta City Council put their announcement up a few days ago. So they're rolling that out through all of their venues.
Hi Pat, I was just wondering with the resources that you developed, I suppose how you came about with the idea to make the content. Was it sort of out of your own head or did you work with
To make that one?
Yeah, and also
Okay.
the form as well.
Pardon?
And the form,
Oh yes, okay. Well, I'm a member of Quota International, and they support hearing and speech impaired worldwide, and so that's why I joined the club. So I knew I'd be at the table where we can all talk about hearing loss or whatever it is. And so this particular hearing helper came about because I didn't want a manual to be stuck in a drawer that I was involved in. You know, this should not be stuck in a drawer. And that's how we, together. And Cochlear, as you can see, they supported it and helped us with the funding to put it together. And the idea that it's on a hook, not lost.
I just had a follow-up question. So, you know, if we, or Hearing Matters Australia, wanted to do, you know, a revived version of the hearing helper, because as you say, you know, maybe aged care facilities nowadays aren't using these anymore. How do we have a conversation with Cochlear about funding another attempt?
Well, I'll put it to these two.
Look, definitely something we can do.
Yeah.
Because I think that's a great resource. Because, look, as you know, Pat, on a simple level, it could be hung on the hook next to someone's bed in a hospital.
Yeah.
Or it'd be an aged care facility in a nursing home. And it's readily available to people, which, like you said, it's not hidden away. And there's a few things that have changed since that was first done. So doing an updated version, I think is definitely a great idea, because it puts the basic information in front of the staff in the hospital.
Yes.
In fact, even visitors. People come in to visit someone who's in hospital.
That's right.
And who can just pick it up and read it. Hey, you know, the person I'm talking to has got hearing loss. How can I accommodate them? So that's the beauty of this particular guide.
That'd be great.
Yeah.
To get it revised, yes.
Okay.
Right. Thank you all for your interest,
Yes.
and we can spread it and go further. That would be very good.
Yeah, so Pat, thanks very much for sharing your story and your tips and advice. And Brian has now given us a challenge to update the guide. I think it's a great resource. And then your comments about, you know, something that's ready and to hand is useful.
Yes.
Whereas a guide that's put on a shelf or in a cupboard, but just doesn't get ready.
That's right. Yes.
So yeah, I think it's very valuable. And
Good.
what you spoke about today, and also what you spoke about when you did your talk up at Castle Hill last week, you know, it sort of got people to think that they could, you know, there was a lot of comments from people who were saying, you know, oh, it's just part of getting older. You know, one day I'll do something about it. And I'll be talking to someone who's in their late 70s, and they're telling me one day they'll do something about it. And then, you know, your when you talk to people, you can go, well, you can do something about it now. You know, and so that continued encouragement of people to do something is very valuable. So thanks very much.
And I think for public in general, put off by audiology companies, you know, who sort of are at the shopping centre or somewhere like that. They're confused about what they should be doing because of the cost of everything. Whereas Australian Hearing is the government program for the country. And they fortunately have put out some very good information now. Very good. I had them the other day, last week when we were at Castle Hill. They've got good information for people now. And look, when you go to buy a car, you go to different places and sort out what you need. Well, you can do the same with the audiologists. You don't have to stay with the same. You need somebody who's understanding you, you know, for what you want. And if it's not them, we'll go somewhere else.
It's like that next step can be scary for some people.
Of course.
Like with that buying a car, I think, oh,
Yeah.
am I going to the right place? Am I doing the right thing? It
Yes.
could be scary, yeah.
Yes. Thank you very much.
Okay, thank you, Pat.
you.
Thank you.